Well, the doctor is in. Today it is pediatrician Dr. Robert Wittrock from Ascension St. John Pediatric and Adolescent Medicine. Now, with all of these respiratory viruses going around, we want to give parents some guidance on when to see your doctor, when to wait it out, and when you should go to the ER. Thank you for being here as always.
Absolutely, yeah, thanks for having me.
So, as we were just talking about, there's more than just RSV going around. There's several viruses parents should be aware of.
Yep, it's kind of RSV, and that's kind of the king of colds, but we've also got flu, rhinovirus, enterovirus, Coxsackie virus, parainfluenza virus, millions and millions of viruses kind of going around, and they're all starting to peak up a lot earlier this year than what we've seen in the past. So we're starting to see a lot of surges. A lot of the ERs are starting to get overwhelmed. The children's hospitals, our clinics, things like that are just starting to see this mass patient flow of kids with snotty noses and fevers.
When parents are watching this and maybe they're seeing some symptoms, when should parents wait it out?
Right. So the first thing I always tell people is this is the usual expectation of how these viruses kind of go. And like I said, RSV just tends to have a little bit more severe symptoms than a lot of the other ones. Usually you get fever for about 2 or 3 days. Then you get this cough and congestion that can kind of peak at around day 5 and 6. And usually about day 5 and 6 is whenever our symptoms get to be the worst. If around those times they start having difficulty breathing, they're so congested that they can't tolerate fluids. They're starting to get dehydrated. If their fever sticks around for longer than 4 or 5 days, or it gets high enough, then I say, you know, it's about time to go and get your kids seen, okay? The main things that I have people, that I talk with people about is, okay, when should, if it's the middle of the night, because symptoms are always gonna be worse during the middle of the night, when should I take them into the ER versus just waiting until the next morning? The main symptoms I'm looking for is work of breathing. If they're using their lower rib muscles, and this can apply to young infants or older children too. If they're using their lower rib muscles, if they're using their neck muscles to where they're having to, you see this kind of V between their muscles, they're really working hard and they're breathing fast, or if they're making like a loud whistling noise, kind of like a wheeze or a stridor, that's whenever they breathe in and it's a loud whistle, then I say just go ahead and take them in. Other things that kind of point out, you know, if they haven't had any urine output for 8 to 10 hours, then I'm really worried about them being dehydrated. If they're having difficulty staying awake, like more than just lethargy, but they're just out. If they have a fever above 105, I say go on in. But you know, you will get some 103, 104 fevers that can kind of come and go over those first couple of days. And then, like I said, whistling noise whenever they're breathing, those are the things I kind of start to worry about. Of course, most pediatric clinics and urgent cares, they have a on-call service. So if you're in the middle of the night and you don't quite know which direction to go, you don't want to sit in the ER for 8 hours, but at the same time, you want to take care of your kid, just call your pediatric office. Usually they have an on-call nursing line that can kind of help walk you through this kind of thing. I kind of do the same thing whenever my kids are sick in the middle of the night and I don't want to make that doctor judgment call. I call one of my friends or my own kid's pediatrician and just say, hey, where should I go next? Help me make this decision.
A lot of help out there. Well, Dr. Wittrock, thank you as always for being here. Very informative information for parents out there.